Hello, beautiful people, and welcome to my channel. I'm super excited to have you here. In today's video, I will be teaching you how to carry out blood glucose monitoring in your OSCE exam. It's one of the simplest skills, but lots and lots of students have to go back for a resit because of one or two mistakes. I will be teaching you all you need to know to pass your blood glucose monitoring OSCE exam in just one attempt. If you are interested, please stay tuned.
Ryan Little.
Hello, beautiful people, and welcome back to my channel. In today's video, I will be teaching you blood glucose monitoring. Blood glucose monitoring in your OSCE exam takes just 8 minutes, but with my tips, you're sure going to finish the station in 6 minutes. Before we go to the station, I want to give a massive shout out to over 70 students who have passed their OSCE exam. Yes, guys, I keep saying it, OSCE is simple and nurses are brilliant. So I'm so proud of you, Ruth. I'm so proud of you, Meryl. I'm so proud of you, Mary. Well done. I'm also so proud of you, Nelly. I'm so proud of you, Puma. I'm so proud of you, Charissa. I'm so proud of you, Nikta. I'm so proud of you, Dako. I'm so proud of you, Glory. I'm so proud of you, Gudu. I'm so proud of you, Angela. I'm so proud of you, Nikki. I'm so proud of you, Praise. I'm so proud of you. Guys, I can't mention all the names, but I'm just going back to those of them who sent me a message that they have passed their OSCE exam. I'm so proud of you, Alice. I'm so proud of you, Chinaza. I'm so proud of you, Blessing. I'm so proud of you, Favor. There are lots. I'm so proud of you. Guys, these are some of the messages they sent for passing their OSCE exam. So if you are writing your OSCE exam soon and you are scared, the exam is ABC, trust me. Lots of my students finish assessments in just 12 minutes, okay? So be confident, you are sure passing your OSCE exam in one attempt, trust me. All right, let's get to blood glucose monitoring. Now, your assessor says to you, your next station is going to be blood glucose monitoring scale. And she says to you, Violet, can you read a question there? And you say, and you read the question, it could say things like this: carry out a pre-meal blood glucose on Mrs. Ellie Brooke. Now, the question has read carry out a pre-meal blood glucose, so you're going to record that on that pre-meal. Now, sometimes the question could be carry out a post-meal blood glucose on Mrs. Ellie Brooke. So bear this in mind, when you are done with your procedure, you have to record it on that post-meal. Now, just in case you don't know the chart for blood glucose, I'll be sharing with you on the screen now. This is the chart for blood glucose in your OSCE exam, all right? And that's clear. So now we have read the question. Sometimes it could also come carry out a blood glucose on Mrs. Ellie Brooke. So whichever it comes, by the end of the video, you will know how to chart it, okay? So now I want to go to the patients. First thing first, you must check for scene safety. Failure to check for scene safety is a fail in OSCE exam. Yes. First thing first, assessor, I check for scene safety. I provide privacy for my patient, and I do my hand hygiene according to World Health Organization. So palm to palm, back of hands, interlaced, interlocked, rotation of the thumb, tips to the finger, and the wrist. My hands are clean. This also tell you assume patient identification have been done. And if they tell you like that, hello, my name is Violet. I'm one of the nurses looking after you today. Hope you're all right. I'm here to carry out a blood glucose on you, or depending on your question, a pre-meal blood glucose on you, or a post-meal blood glucose on you, or a blood glucose on you. Why did I mention this theory? If you have been following the video from the beginning, you should understand that, because those are the ways the question could come. And you ask the patient, is this a convenient time? The patient say, yes, Nurse Violet. All right, do you have any allergy to any of the items I will be using at all? Any allergies at all you want me to know of? The patient says no. All right, my darling, I'll leave you with a call bay while I assemble all the equipment needed to carry out this blood glucose, since you are happy for me to carry out blood glucose on you. And that's all. Somebody might say, Nurse Violet, why didn't you ask the patient their name, date of birth, blah blah blah? You don't have to ask name, date of birth for blood glucose, okay? Because the assessor said all identification have been done and it is not in your marking criteria to ask for name and blood glucose. But if you do, that's also fine. Remember that this station is just 8 minutes, okay? So now I leave the patient to the call bay. I will do my hand hygiene. Palm to palm, back of hands, interlaced, interlocked, interlock, rotation of the thumb, tips to the finger, and the wrist. So do your hand hygiene. Put on your apron, put on your glove, assemble all equipment you need for this blood glucose monitoring. The first equipment you need is your glucometer. Assessor, this is my glucometer. It is within date. I'm happy to use assessor because you may not see the expiry date on the glucometer. But you could say, assessor, can you confirm this glucometer is within date and use? Assessor will say yes. Now your lancets. This is my lancet. The expiry date of this lancet is 2028. I'm happy to use. Check your lancet expiry date. And if your lancet does not have an expiry date, verbalize to the assessor. Assessor, can you confirm my lancet is within date and use? Assessor will say that's fine. All right, your blood glucose strip, verbalize the expiry date. This is my blood glucose strip. The expiry date is 2028 November. I'm happy to use. Your gauze or your cotton balls. This is my gauze or this is my cotton balls. The expiry date is 2028 November. Assessor, I'm happy to use. This is my sharp bus. Endeavor to take a sharp bus with you. Now you've assembled all your equipment. Now you have to go back to your patient. Mrs. Ailey, I'm back. Are you still happy for us to continue? The patient says yes. Now, first thing first, I can confirm that your hand is visibly clean. Remember that you are having a manicure for the station, but you have to verbalize, I can confirm that your hand is visibly clean. Now I'm going to be pricking the finger. You should be pricking the side of the finger, not here. This is not where you prick. You should be pricking the side of the finger, and you must verbalize to the assessor that you will avoid using the thumb and the index finger. You will verbalize to the assessor that I will not use the thumb or the index finger. You must verbalize to you that there will be no blood coming from the mannequin's hand. So the assessor is going to be giving you a sample to be used for your blood glucose. Does that make sense, guys? If you have any question, pop it in the comment section. By the way, if you click on that join button showing now on your screen, you'll become a channel member and you are going to get every nitty-gritty why people fail blood glucose in their OSCE exam. So do yourself that favor now. Click on the channel member, just click on the join button, and the same video I posted here will be posted on the channel member group, but in more details. I will elaborate there reasons why people fail blood glucose. You don't want to miss it. So click on the channel member join button. So I will prick the side of the finger, ensuring that the side prick is evenly rotated. Remember, I will avoid the thumb and the index finger. Immediately I finish pricking, that needle or that thing I used to prick, that sharp, goes immediately to the sharp balls. And this is why lots and lots of students are failing their OSCE exam. After pricking the patient, they put the sharp in their tray. Immediately after pricking the patient, that sharp should go into the sharp balls straight away. And once you've put it in the sharp balls, insert your strip into the glucometer, and bleeping, you put your sample. The mannequin is not going to give you blood. Your assessor is going to be the one to give you the blood or the sample. So you put the sample on the strip, on the window of the test strip, and make sure the window on the test strip is entirely covered with blood. Ask the patient, do you want gas? Because obviously you've pricked the patient, and if they say no, that's fine. If they say yes, then you give gas to them. Now wait for your reading. Immediately you get your reading, you verbalize to the patient that your blood glucose reading probably is 4.0. I will just quickly record this. Now, record your blood glucose reading. These are the charts. If you were asked to carry out a pre-meal blood glucose, record it on pre-meal, write your date, write your time, record it on pre-meal blood glucose, and give your signature. If you are asked to carry a post-meal blood glucose, write your date, write your time, write the blood glucose reading, and record it on post-meal. If you were not told whether to carry out a pre-meal or a post-meal blood glucose, your question just says carry out a blood glucose on Mrs. Haley Brooke, and the chart you are having read pre-me and post-me. Ask the patient, have you eaten? If they say they have eaten, then you record it on post-me. If they say they have not eaten, then you record it on pre-meal. All right. Now, also, some charts, remember there are two types of chart for blood glucose. Some charts does not carry pre-meal or post-meal. It just carries dates, time, blood glucose reading, and signature. So charts. All right. Now, after you have charted, tell the patient if their blood glucose was within range or not. Mrs. Haley, your blood glucose for today is 4.0 and the normal blood glucose is 4.0 to 8.0. I'm very happy that your reading is within range, okay? So I have no concern. I will now assess or I will now discard all my equipment to you. So the strip in the blood glucose machine, take it, dispose of it properly. Make sure you dispose of it properly. Sharp goes into sharp, every other thing, dispose of it properly. Now, what if the blood glucose is not within range? If the blood glucose is higher than normal, verbalize, I did your blood glucose. Normal blood glucose is 4.0 to 8.0, but yours is 9.2, for instance. I will escalate that to the doctor and I'll come back to monitor your blood glucose. All right. If it's below normal, your blood glucose is 3.2. I'm not happy with it. I will escalate it to the doctors and I'll come back to monitor you and I'll get you something like a juice just to boost the blood glucose. You must make sure you comment on the results. After that, take off your apron and glove and do your hand hygiene, and that is the end of the station. Now I'll be expatiating more on this on the channel member, so do yourself a favor, click on the join button so that you can get more reasons why students fail blood glucose monitoring in their OSCE exam. All right, thank you very much for watching. I'll see you in another of my juicy video. Until I see you again, keep passing your OSCE exam.